First stage is freezing pain phase. This takes place from 2 to 9 months. There is an insidious onset of pain with progressive loss of motion. It's characterized by synovitis that progresses to capsular thickening, particularly in the anterior and inferior portion of the capsule, with an associated reduction in synovial fluid. Frozen stiffness adhesive phase lasts between 4 to 12 months. Fibrosis of the capsule is more pronounced and thickening of the rotator cuff tendon is common. There is an pain with progressive loss of motion, and the buildup of scar tissue restrict movement inside the joint, resulting in pain and severely limiting motion. The last stage is thawing resolution phase. Takes place in about 6 to 9 months. There is a pain resolution and complete range of motion is gradually attained after 1 to 3 years. The pathology. Every joint is covered by a capsule that is made up with a lining known as a synovium. Inflammation of the synovium, synovitis, is the initial cause of pain. Fibrosis in the process of tissue repair brings about the reduced range of motion. Now we can see the difference in two images. First is normal shoulder joint, a normal capsule shoulder blades. Now the second one picture is the frozen shoulder joint, adhesive capsulitis, and we can also see in which thick and inflamed capsule and dearrangements in the capsule. Next, diagnosis. This condition is a clinical diagnosis that is diagnosed through clinical presentation, physical examination. First is clinical presentation. Gradual onset of progressive pain. Pain worsens during night, awakens from sleep, especially when lying towards the affected shoulder. A reduced range of motion in all planes. Difficulties with activities of daily living such as tucking in shirt, fastening a bra, combing hair. Complaints of neck pain and pain down the arm. Pain put stress to the neck. Physical examination. Measurable reduction in both passive and active range of motion. External rotation is marked restricted. Abduction is restricted. Flexion and internal rotation are slightly limited.